where it is, I had done IUI last month, but it failed. Every parameter was good, but the endometrium shrunk from 10 millimeters to 7.9 millimeters after egg rupture. Does the endometrium shrink? Was it the reason for IUI failure? It's a very good question, actually. See, post ovulation, most of the times the endometrium, along with having been primed with the estrogen hormone, has the effect of the progesterone also over it. So, the effect of progesterone is slightly different on the endometrium compared to the effect of estrogen. And the effect of progesterone is such that it will slightly shrink the endometrium, or rather, it has a compacting effect on the endometrium. So the endometrium can shrink from 10 millimeters to 7.9 millimeters post ovulation. It is quite possible. But then again, not all endometria shrink to almost more than 2 millimeters. We usually say under the effect of progesterone, the endometrium shrinks by zero point 0.5 to 1 millimeter. But even if it shrinks around 2 millimeters, it should not have any negative impact on the pregnancy outcome. Was this the reason for IUI failure? Very difficult to tell based on only the endometrial thickness. There could be other reasons like is the tubal factor good? Have the tubes been tested for their patency? First thing. Second thing, are the semen parameters good? What was the reason for IUI? Is it because of unexplained infertility? Where we can say that this endometrial shrinkage could be one of the reasons if it is really shrinking much beyond this value. Or is it because of tubal factor? If it is not checked, then it is better to check the tubal factor. And then is it because of the semen parameters? If there is suboptimal semen parameters, then the chances of pregnancy will be slightly lower. And if the questions ask that is 7.9 millimeter endometrium at the time of IUI adequate enough to give a pregnancy? Certainly yes. Any endometrium more than 7.5 millimeters should help a woman achieve pregnancy.